My name is Nana Dagadu. I'm a research officer here at the Institute for Reproductive Health at Georgetown University. I always wanted to work in health. I thought I'd be a nurse or a doctor. Started taking pre-med classes at Georgetown University, and then my junior year, I actually started taking one public health course. It was a global public health course, and fell in love and switched, to the chagrin of my parents, in my junior year to public health, and then went to Tulane and started studying really more about maternal and child health and sexual and reproductive health. I started working at IRH once I had completed working in Benin and the Congo, the Democratic Republic of Congo. I was looking to move back to the US for family reasons, and thought the Institute would be a great place to get more research experience. So a position opened up in monitoring and evaluation for a project in India, and that's the position I applied for and started working here in 2012. At IRH, I have a few different hats that I wear. So my role primarily is to manage two projects, the Gender Roles, Equality and Transformation Project in northern Uganda, which is working with 10 to 19-year-olds to improve outcomes around gender-based violence, sexual reproductive health, and really working on gender equality and transforming some norms around that. And also managing an OVC project, or an Orphans and Vulnerable Children's project, in central and western Uganda with Catholic Relief Services. And then apart from those, I also do monitoring and evaluation for the FACT project, which is the Fertility Awareness for Community Transformation project, and really working across the Institute to build learning across the different projects and across sort of looking at scale up and norms change in sexual and reproductive health. My favorite part of working at IRH really is that I get to use different skills on a daily basis. So I can go from being a program manager to being specifically focused on monitoring and evaluation, and then working also on partnerships, all in the same day. So I think it's never a boring time here. There's a lot to do, and I really enjoy also interacting with the different people that are involved in using those skills. So I think pretty much interacting with finance, admin, the research team, as well as our different partners. IRH, I think, has a lot of added value. We are focused on implementation science. So really looking at rigorous research, but what it means in the context of the real world. Really looking at the environments in which we work, the policy settings, as well as what people on the ground need. And so the research, really using that to inform all the work that we do. And I think what's great is that we are a small organization, and so can partner easily with the implementers who are on the ground, who have the connections. And I think that has really helped to inform the work that we do, but also that the implementers do, and ultimately then increasing the impact that we're able to have out in the global level. Everyone's got a lot to do, and sometimes that means just being a little bit frantic in terms of getting things done and making sure we're meeting all our deadlines and our targets, and obviously also interfacing with the university and other people that we have to work with. I think that's maybe the biggest challenge, I would say. I'm really most inspired, not just my faith, but also by the people that I come into contact with. So really, I think my personal values, my personal beliefs help me not only do my work better, but I think to sort of conceptualize what it is that I'm doing. But then really the people that I work with here at IRH, our partners, and also going to the field and hearing the stories of what happened as a result of our work, and also what's going on as we conduct research. I think that's really powerful and really helps me to keep going on when there are those challenges in terms of managing the workload.